Hi, welcome to Lifestyle Matters. I'm Matt Schultz, and we are at Eugene Foot and Ankle today. We have the pleasure of visiting with Dr. Dusty McCourt. Hi, Dr. McCourt.
Hi, thanks for having me.
Thanks for having us in. It's great to be back. And talking about something today that I know affects me and a lot of people I know, and that is heel pain. Ow, it is a very real pain.
Absolutely.
What is heel pain? Where does that come from?
Well, first of all, it's something that about 40% of people are going to experience in their lifetime. And I mean, the critical thing about it is people don't really understand that this is just an injury. Like I see a lot of people where they just feel like, this is what I have. Like it's a diagnosis, like a lifetime diagnosis. It's an injury. It's a tissue stress injury, and that just means it's something that we can get you through. And now we understand a lot more about it, such that we're really able to get most people through it without having to do any sort of surgery.
I really appreciate you saying that. I'm one of those people who thought it was just something I had to live with. Yeah, very good to know. So where should I start in trying to cure my heel pain?
Well, I don't think it's bad for, everybody goes on Dr. Google anyway. I'm just going to tell you to do that. And then I mean, the thing that you'll see as a baseline, pretty much everyone talks about is doing some stretching. And for me, it's the runner stretch is probably the one that's the most helpful for people. And so I would say start with that. But beyond that, if you're not getting better, I would certainly urge you to get in here as soon as possible so that you don't end up with this recurrent problem. And of course, decreased quality of life.
Yeah,
nobody wants
it really easily can decrease quality of life for sure. So stretching, great place to start. All right, that's helpful to know. Let's say that I've gone through the stretching, I've been trying that, and I'm still not feeling any improvement or noticing any decrease in pain. What should I do next? After I come in to see you.
Yeah, so that was what I was going to say. Is the next thing is really don't wait. The sooner that we're able to see you, the sooner we're going to be able to get you through this. A lot of people, they fear going to the doctor's office, or they think that they can get themselves through, and then those are the people that just end up with recurrent cases. So come in quickly, such that we can do some things to change the course on it, so we can get you better faster, getting you back to doing the things that you want to do.
Okay.
So when we have you come in, the first thing that's going to happen is we're going to take an x-ray. We're going to look at the bones to make sure there's nothing in there. Like sometimes we see cysts, tumors, etc. So we'll start there, then we get the ultrasound. I'll be doing it for you right at the bedside, and so you'll be able to see actually what's going on. And so we can see tears, we can see partial ruptures, we can see how big it is, which kind of tells us where we're going and how long perhaps it's going to take for us to get you through it. So we'll do the imaging first, and then we really kind of launch into how do we get you better.
Right. Okay, great. So painless diagnostic, very advanced
Absolutely.
Way of looking at where the problem really is. So then let's say that, we found the problem and, I guess what next?
So yeah, that's another thing that really kind of separates us from a lot of other places, that we have more modalities than anybody here in town for this. And that's not just the ultrasound, but we also do things like shockwave, for example, which is a non-invasive, no downtime, no side effect treatment. Traditionally has been meant for more of the chronic cases, but now we have some really good literature coming out that demonstrates the use of it in the acute phase. And really the whole point of using that versus any of the other modalities is to get you back to doing the things that you want to be doing faster, So, and that means training for a marathon versus, taking your dog for a walk. It's whatever.
That's great. Well, I loved when you said non-invasive.
Yeah.
No
people
injections.
Like that.
That's really great to know that there are so many different options available to treat this rather than just assuming that it's surgery.
Yeah.
That's great. Dr. McCourt, thank you so much for talking to us today. And our KVAL viewers at home, thanks for watching. You see the number and the website address for Eugene Foot and Ankle on your screen. Stop living with pain. Call them today. That's all the time we have today, but we'll see you right here next time on Lifestyle Matters. Bye-bye.